Alldus podcast is brought to you by Alldus International, supplying your expert AI and digital transformation staffing needs across the US and Europe. Today, you are listening to our AI in Action series, where leading minds in AI from across the world share their story, success, and advice. AI in Action cuts through the hype and explores the true impact of artificial intelligence in our world today.
Welcome to the Alldus podcast. Today's episode is with Kedar Mate, founder and CMO at Qualified Health. Kedar, thanks for joining me today. I guess to kickstart things off, why don't you tell us a little bit more about the start of your journey here to Qualified Health?
Well, first of all, great to be with you. Thanks for having me on the program and looking forward to this conversation. Yeah, so I'm happy to talk about how I got to Qualified. Starting from the start, if you will, I grew up in New Jersey, son of two Indian immigrant parents, got a chance to do a lot of traveling back and forth to India with my family as I was a young person, and noticed a lot of things about the differences in standards of living and the way in which the socioeconomic spectrum played out in either of these two countries. And I think that gave me a sense that I wanted to do some work trying to work on health inequities that were present and the kinds of social challenges that people were facing. Actually, I didn't know that it was going to be in healthcare. I did know that I wanted to work on the problem of inequity. I kind of came to health as the vehicle a little bit later in my life when I started doing work with an organization called Partners in Health, which was based in Boston, but doing work in Haiti and Peru at the time and parts of Africa. And this was the organization started by a visionary physician in Paul Farmer and Jim Kim and Ophelia Dahl and several others. And the real emphasis of that was it was a group of doctors, yes, but also anthropologists and public health professionals and policymakers and economists. And I found myself at the end of the day enjoying what the physicians were doing most and felt like they had the most to, contribute or give back. Not everybody had a role to play, but it was the doctors whose work I admired the most. And that led me to go to medical school and start training as a physician, which is what I am now. I'm an internist by background and faculty at Weill Cornell Medicine in New York City. And along the way, as I was working on the concerns of the resource poor, I got interested in healthcare policy because, of course, if you go upstream from what was causing the problems that people were facing, you start to tackle, how do they get there? And that's a policy question usually. And so I worked at WHO for a while, worked a little bit alongside of folks at the Centers for Medicare and Medicaid here in the US, met another visionary clinician named Donald Berwick, who was the head of CMS at the time, our Centers for Medicare and Medicaid under the Obama administration. And Don and I became friends and colleagues, and he invited me to come work at an organization called the Institute for Healthcare Improvement, which is a Boston-based quality and patient safety organization. And I was there for more than 10 years as the chief innovation officer and then the chief executive for 5 years. And when I was the chief executive, I was a CEO during the time when COVID happened. That was the first 2.5 years of my time as CEO. And the latter 2.5 was after the public release of ChatGPT. And so healthcare was starting to try to figure out how to work on this problem or challenge or opportunity of generative AI. And, I started talking to people who were working in generative AI. And I quickly felt like healthcare was going to have trouble adopting this technology. By definition, it hallucinates, right? That's a feature, not a bug. It makes mistakes sometimes. And how could we use a technology like that in such a, risk-sensitive situation like healthcare? And I found my co-founders, Justin Norden and Bo Norjo and Shantanu Fatakwala, who were all in different ways. We were all in different ways thinking about how to solve the problem of getting to widespread adoption of this technology, which we all regarded as super powerful and very important, but with serious risks and safety concerns. How can we make that something that health systems could really use at scale? And those conversations became the beginnings of the company that we co-founded together called Qualified Health, which today is that enterprise partner to health systems all over the country.
What a journey to get to that as well. And obviously, startup life is not easy either. So, but there's also a lot of people trying to solve like different problems in healthcare with generative AI as well. So, for those that don't know, so who is qualified health, and what is the problem you guys are going to dig in to solve?
Yeah, well, I mean, one way of answering that question is literally who is qualified health. So
Yeah.
I mentioned my four co-founders. Justin Norden, our CEO, is a physician, also a physician and computer scientist from Stanford, found the faculty at Stanford. He's been super interested in this question around creating safe and secure AI for his whole career, his whole life. He actually built a company called Trustworthy AI. He trademarked the term Trustworthy AI back in 2016, 2017. He built it for healthcare, but it was too early. The market wasn't ready yet. Healthcare wasn't adopting this technology at scale. So he ended up pivoting and selling the company to the industry that did care about safety and security of its algorithms, and that was the autonomous vehicle industry. And he sold his company to Waymo, which is Google's self-driving cars. So if you've ever been in San Francisco, you might walk around and see the Waymos rolling around in the streets, and the fact that they don't hit pedestrians and run into, I don't know, buildings and street signs, you at least have a part to thank Justin for, because he was created some of the safety and security technologies that are now embedded in Waymo's technology and makes those cars safe to drive and use. Bo Norgeot, our CTO and chief AI officer, is a PhD AI researcher. Spent his time at UCSF with the tool Butte, learning about this technology in the early days, and then took his talents to both the startup world as well as to the Elevance Health, the payer side of the business. So he's grown AI teams and worked on AI technology for years. And then Shantanu Fathakwala was the chief data scientist for Haven. Some of your listeners may remember Haven. This was the Berkshire Hathaway, JP Morgan, Amazon trifecta that was trying to sort of solve healthcare for their employees, at least to begin with, and maybe cascade it further than that. And Shantanu was the chief data scientist and a research officer there. And he also worked on value-based care at Evolent Health. So we have this kind of very healthcare native founding team. And then we have another way of answering the question of who are qualified health is the other 100 or so people that work for qualified. A lot of amazing engineers, super talented AI researchers, engineers, leaders, as well as a very strong group of individuals who have led healthcare transformation efforts using technology for their entire careers. So these are people who come from places like McKinsey or Bain or BCG or advisory board company. These are folks that have been working in the industry for a long time and that know that technology alone is insufficient to solving the problems of our health systems today, that we actually have to combine the technology with workflow transformation, with change management for the people inside the organization. They know that we have to meter the technology into the organization. It's not, you don't just drop the whole thing and go. You have to build trust in this now, and especially with a technology like generative AI. So a little bit of microdosing AI to begin with, and then scaling it as it demonstrates capacity is a little bit of our implementation philosophy, and then eventually reaching everyone. But that, a little bit of going slow to go fast is super important for this. And that's a lesson that all of these folks that work on the implementation side of the house know really, really well. So a combination of amazing engineering, state of the art, along with people that understand healthcare so well that they can support the transformation actually required.
Absolutely. And I think, the founders coming together and sort of spotting this sort of issue in healthcare as well is how many of these stories created. In terms of that, like, what was it out of the many problems in healthcare you could solve? Why was this an important problem to solve?
Yeah, well, I think, partially Justin had the experience already of like trying to convince healthcare to work with AI and had really struggled with it, right? With his first company. It just wasn't important yet, important enough yet. And so when we started talking in the early days about like kind of what were the barriers to entry for this technology, we got really specific about it really quickly in the beginning. And this is what came to define what a platform means to us. So for us, a platform, you hear the words platform, we're a platform, we're the generative AI platform for X industry or whatever, right? You hear that a lot. And a lot of what people mean when they say that is they've stitched together not just one point solution, but 3 or 5 or 10 or 20 maybe. They've kind of combined them all, and now we're a platform. That's not how Qualified thought of itself as a platform. The way we thought about ourselves as a platform was to solve the major obstacles, or to overcome the major obstacles to adoption. And we broke those down into sort of 4 primary obstacles. One was data disorganization in healthcare. There's lots of structured and unstructured data located, scattered throughout various systems of record. At one count, last count, we were at a system. I was at a health system yesterday. Over 100 current applications being deployed in that enterprise, right? And it makes sense that there would be. It's been kind of growing, and people have been adding on for a long time, but we knew that the data was going to be disorganized when that became true. So part of the first thing we sought to solve was to create a data platform that would normalize the data, that would ensure that it was sort of AI ready and quality controlled, et cetera. The second problem was to create a smart set of applications where value was going to be returned to the system, right? Not 2,000 applications to solve every problem in healthcare, but a curated set of high value, high ROI initiatives in across what are now 4 verticals for us, rev cycle, operations, quality, and clinical. But these are the domains, and we are now building out a set of, we've already got about 30 applications. We're scaling that to 50 to 60, but this will be the applications that are the highest value applications in healthcare that we can see that drive real dark green dollar ROI. And then a builder layer, right? Because we knew that even if we created the first 90% of an application, the last 5 to 10%, the last mile, was going to need customization so that it fit within the workflow, that it fit within the technology environment. And so we created a builder layer so that people could adapt those technologies to their environment. We also created a builder layer because there will be people inside of the health system that want to create their own agents and their own automation tools. And we have a thesis as a company that we want to democratize access to these technologies so that it's not seat-based licensing. We want to create the opportunity for everyone to have their own personal, our vision is that everyone has their own personal AI agent that helps them get their job done. And so again, a builder layer to help them do that. And then lastly, we wrap all of this with a governance solution so that every application, every agent that's created has an audit trail so that the administrators in the system understand how the applications are performing on a real-time basis, can check against the parameters and benchmarks that they've set, and can say this application is doing, is hallucinating too often, or there's been a switch in the model, and now this underperforms our benchmarks and our expectations, or there's been a switch in the model and conversely it's outperforming our benchmarks. Maybe we need to raise our benchmark, but we have this kind of ability to see in real time how every application that a health system platforms actually is performing on a real-time basis. And it's those elements, data, high-value applications, builder tools, and governance, that is what we defined as a platform, which is not just simply a collection of point solutions all knitted together.
So what do we think in terms of like that solution between the builder platform, the governance, and how is this then holistically going to impact healthcare companies and healthcare systems?
Yeah, maybe I'll give you an example here just to get into it like more specifically, but we early on started working with University of Texas in medical branch, so the UT campus with one of the biggest medical centers in the system, 15,000 employees. We turned on our chat tool, and this is the democratizing access component. We turned on our chat tool, which is a HIPAA compliant, secure GPT. All 15,000 employees within 48 hours of contract signature had access to all the major foundation models that are in the market today. We keep them up to date. We auto route queries based on intent to the model that outperforms today. And that's like if it's a quantitative one, we'll send it to this, Gemini. If it's a subjective scientific one, clinical one, we'll send it to Anthropic. It depends on the nature of the question, but we in the background we're orchestrating the routing to the appropriate domain. So that's the chat. We turned that on in 48 hours. Within 2 weeks, we had trained them on how to create their own agents and tools. And, we had 10 to 15, 20, 30, 40 people come out and start building tools. And, We had suddenly hundreds of agents and applications in our application library. And then in the back end, we started working with them on application, the high value repeatable workflows where people were going to, again, these are some of the workflows that we had pre-built already, but we were now connecting the data to make sure that the data would flow correctly and on the schedule that we needed for those applications. We built one application revenue cycle and it started delivering value right away to the health system. Dark green dollars paid for the contract within a couple of weeks, candidly, of using that technology, of that particular thing. And then a clinical one, and this is one that, because as a clinician, I'm particularly excited about. We worked with their cardiology team on heart failure specifically. And here the problem is, and some of your listeners may not know this, but despite having strong evidence on what it takes to, improve care for patients with heart failure, we underperform just for a lot of different reasons. We only get it right about 30 to 40% of the time at best.
Wow.
And so there's lots of opportunities to close gaps in care. Some of that is on the patient side, some of that is on the providers not recognizing things that could have been recognized. And some of it is like almost purely logistical, just having a repeat, EKG or a repeat what we call an echo, an ultrasound of the heart on a regular basis, optimizing people's medicine, making sure if they have a particular kind of heart rhythm that is treated appropriately, and so on and so on. And so we started looking through 2 million records. We isolated the 100,000 patients that actually had heart failure within their 2 million records. And then we looked at the 45,000 patients that had a very weak heart, in this condition, what's known as low ejection fraction heart failure. And then from those 45,000, we started to identify gaps in clinical management. And we basically found 1 in 3 of those patients, about 30% of those patients, had some kind of clinical gap that we could improve. And then from there, we found that about 1 to 2% of them needed a particular procedure done, which was the placement of what's known as a defibrillator, an implantable defibrillator. And this is life-saving. If you don't get this, if you have this condition as a patient and you don't get a defibrillator, your 1-year mortality is 27%, meaning, so it's a lifesaver. Yeah, huge. And so we found 800 patients that were eligible for this particular intervention that had never been offered that intervention before, right? So 800 patients. So you can imagine that 27% of those 800 patients would likely have passed in the next year had they not gotten this intervention done. And so, you get where I'm going with this, but, actually this is life-saving stuff that we're talking about here. It's not just sort of nice to have kind of, whatever, cute AI. This is like actually helping to solve a real problem in how we deliver healthcare today.
Yeah. And directly saving lives, right? In that degree, if you're tackling that problem. So what do you think then has been, because you see sort of stories like that and it's like, these sort of really high impact opportunities with AI in healthcare, what do you see as some of the challenges then, whether in healthcare or even in the sort of area that you guys are trying to take on with AI and its adoption and that?
I mean, I think the reason we kind of backed into the idea of working on the data, because what we found is that the data was always the long pole in the tent, right? Wherever we went, we're now working, Anthony, in 17 health systems in the US. And with every single one of them, data is the first and most important challenge, right? Not that and systems are all over the place in their level of maturity around their data infrastructure. So some are better than others, for sure. But we found that data disorganization is always one of the biggest and most difficult challenges in the beginning. The other is having a governance system that is well set up to manage today's technology, right? So I think the history of technology governance in health systems was a committee that met periodically. And because the underlying technology didn't change that much, it sort of was okay to meet once a month, and do your review and pick your best vendors and do your thing, right? Now that's kind of impossible. Every week there's a new thing, right? Like we're recording this like the week that Anthropic released Mythos to a handful of partners, not to the general public, but to a handful of partners. And that's kind of a new thing, right? And every week there's a new development. And so if you're only meeting once a month, once a quarter, reviewing what you got, et cetera, it's just a different mind frame around how we have to think about governance. We need digital governance. We need technology to police the borders. We actually need a very different way of thinking about this going forward. And then maybe the last thing I'll say is I think many fellow vendors kind of misunderstand their role as being technology developers. And candidly, I don't come from the world of technology development, right? I'm sort of new to this game on some level. Thankfully, I've got co-founders that are well versed in how this works. But my part of this is really about, how do we make this technology work inside of our health systems and in our clinical care delivery environments? And we've just never gotten that really right in any previous instance of technology in healthcare, right? We've never gotten that right. With the EHR, we had to pay people to adopt the EHR, and they still came kicking and screaming, right? We've never really gotten adoption right. And so I'm hoping that we do this time a little bit better, So that part, I think, is that last mile customization adoption, I think is key.
You're not from the technology world, right? From the medicine world, moved into technology and sort of founded Qualified Health. What have you in this journey so far? What have you learned up to now that maybe a viewer thinking about starting their own company or making that switch? And what certain things that you could share with them?
I get a lot of questions. I get a lot of questions about this from fellow, academics and policymakers and people that are in the, in not my old world, but in sort of adjacent areas, I would say. And I would say a few things. One is that, there is not enough overlap between these worlds, actually. My first observation early on, there's a little bit more now than when I first started in this, but very early on, I was like getting to know a whole different community that existed alongside of the community that I once knew, but really the cross-pollination was very weak between them. Very few people were traversing between the policy world and the kind of quality and safety and clinical innovation world and the technology world and the generative AI world. And so that was actually quite interesting. So, I would encourage people that are curious about this to find the right thing and to think about making that jump, as I do think, I obviously think, because I've made this bet, in my life, that this is the future, and we need more people that actually do understand healthcare well to be playing in this territory going forward. So that's I guess the first thing that sort of surprised me, or maybe didn't surprise me, but at least was an observation I'd make. The other thing I guess I'd say is that there were a lot of similarities and yet significant differences between my prior life of leading the IHI and my current life, leading the technology company. And the things that are the same is that I think no matter where you are when you're the CEO of something or the leader in something, you're always building something. If you're doing your job right, I think you're always building something. You're always listening, and you're always selling something. You're always kind of listening to the field as closely as you can and getting out there and trying to understand. And you're always selling something in the sense that, I wasn't selling the technology at the time when I was at IHI at all, but I was selling ideas, concepts, things that we were working on and building, and, kind of that combination of building, listening, and selling feels consistent wherever I've been in my last, many, many roles in my life. What feels different about the entrepreneurial world, and particularly the generative AI world, is the pacing. The every week something new developing in the foundation models. The concept that this is we like to say at Qualified, this is the worst the technology is ever going to be. So we have to keep pace with the kind of evolution of the technology and the hyper competitive environment, and that pacing is tough, and if you're not accustomed to it, candidly, as I wasn't coming into this, it's just a different way of being. So, if you're thinking about making a change and thinking about jumping in on this, just know that is part of the deal, right? You're going to be in a super fast-paced environment, people that are going to work hard. My hope and our philosophy, culture of Qualified, somebody was asking me yesterday, I was interviewing a candidate, And they were asking me, what's the culture of the place? And I was like, it's this super hardworking environment, but it's the kind of place where, people are doing something late at night or working on a weekend or even in their time, not because anybody has told them to do that, but because it is so exciting and fun to work on it, right? And I think that's like what we might all aspire to, but this technology and this moment and this company today is all about that, right? Finding those it's almost joy. It is. We used to talk in my previous role at IHI about joy in work. One manifestation of joy in work is whether you are excited about, putting fingers to keyboard and building something. And I think we find that a lot at Qualified.
Brilliant. Yeah, and that's such a key part in building a sort of culture like that too.
It's a great question. I think you model. I mean, my view of like organizations. I have a parent of 3 kids. 14, 12, and 9, and I think of kids as a reflection of their parents. I think of organizations as a reflection of their founders. On some level, and I mean, it's not perfect, and by no means do I mean that in the like sort of. I don't mean that in some like weird parental way with the staff of an organization, but I think there's an analogy there that's very material and real. And so I always think of, I think it was, I don't know who said this, but like when something's wrong, look in the mirror. When something's going well, look out the window kind of thing. And I think that is how you build this culture. I think you build it by, focusing on ensuring that the leaders actually authentically live the behaviors and act their way into the culture that you want. I don't think you do it by telling people you want a culture of, creativity, or you want a culture. You can't tell somebody what culture you want. You have to act your way into it. And I think that starts with your leadership. So whoever they may be. Sort
of a lead by doing principle
totally.
in that sense. Kedar, thank you for all of that wisdom. I appreciate you coming on. And if anyone wants to get in touch with you, where can they find you?
Yeah, you can find us at qualifiedhealthai.com. That's the website for Qualified, and lots of really fun things there. Our career site booming at the moment. We'd love to hear from you, and you'll find all the updates there.
Brilliant. Thanks, Kedar.
All right, thank you.
Thanks for listening to this episode of the Alldus podcast. If you enjoyed today's episode, don't forget to subscribe, rate, and review. We are available on Apple Podcasts, Spotify, and any Android podcast of choice. You can also head over to our website, www.alldus.com, to listen to more podcasts, view our open roles, and stay up to date with industry news. Thanks for listening, and stay tuned for more great episodes coming very soon.